Good morning, guys. This is A Loss for Words VSG, Stephanie, and I'm here just to not really an update, but I just, I guess, a weekly episode. Maybe that's what it's called. I went to my last pre-op testing yesterday. I went to I had a 2-hour class that was for patients who were having a surgery coming up in the next week or so. And it was just kind of a, what to expect before, during, and after your hospital admission, some specific do's and don'ts. A therapist came in and talked to us, really informative stuff about the mental aspect of having VSG, having weight loss surgery. Not just VSG, there was lap band, bypass, and VSG patients. Vitamins, went over some vitamins. I found out I'd gotten the wrong vitamins. I had got vitamins from Walmart. I'd bought gummies. I had bought multivitamin gummies, B12 gummies. I bought Calcium Chews, which these are actually really good. They're chocolate. They kind of taste like Tootsie Rolls. Found out I'd gotten the wrong stuff. Apparently my doctor recommends a nasal spray or a sublingual or an injection for B12. And also my doctor does not want me to take gummies. I don't know why, but anyways. And also the vitamins that I chose did not have iron in them. So I'd gotten the wrong vitamins. So they gave us samples of very active vitamins, and they also have a Nascabal. It's a nasal spray for B12. Brand new to me. I had no idea. But anyways, apparently this is something that my insurance will pay for. And if you get the Nascabal, they include all the other vitamins with it. And it comes in a little package every month. It's delivered to your door. I think it's like $25 a month. So I guess I'm going to sign up and get that because obviously I didn't choose the right ones. My weight is down to 304.4. So it's getting down there a little bit, not much. I've been actually sticking really strictly to the 307, or I've been sticking strictly to the 1500 calorie. I actually was looking. Let me see if I have. What did I do with my? Excuse me, guys. When I started Monday on my 1500 calorie, I was just going to see, well, what was I at Monday when I started my 1500, because I did real strict. I've been kind of, playing around with it, but I really hadn't been very strict with it. But Monday I started the strict 1500 calorie, and of course, nothing is ever where you want it to be when you want it to be there. So what was Monday? Monday was the 18th. I know I'm rattling. 306.2. So, I was down not quite 2 pounds in about 3 days. I guess that's good. Anyways, my surgery is at 7:30 in the morning on June 3rd. It's going to be at Norton's Women and Children Hospital, Norton's Women's and Children Hospital in Louisville, Kentucky. Dr. Benjamin Tanner is my surgeon, bariatric surgeon. And really super nice guy. Really like him. Very easygoing, very good bedside manner. He's a very good doctor, and he specializes in bariatric surgery. So he's been around the block a few times. But just had pre-op labs, EKG done yesterday. My EKG showed that I had left ventricular hypertrophy, which I had known. I had an EKG done a few years ago, and that showed up. But it was kind of funny because when the nurse saw it, she thought it was a blip in the machine, something was moving or whatever. So she actually did the EKG again, and when I looked at the results of the EKG and I said, oh, it's, see, I still have LVH. And she goes, well, it would have been would have been helpful if you told me that to begin with, because I redid it because I thought it was, I said, well, last time I had it, she said that's actually a complication of like the diabetes and the hypertension. And so, yeah, just another comorbidity of this dreaded obesity disease. I tried some new things. I tried a pure protein bar. It's this way, 21 grams of fat. It's a good replacement for something sweet. I'm not a big, huge candy bar eater, but I do like sweets. And since I'm really trying to mentally and physically detour myself from sweets, I still feel like I want that sweet taste. This is 21 grams of protein. It's pretty good. It's very satisfying, for like an afternoon snack or whatever. I'm really happy with the pure protein shakes. I've tried the vanilla cream and the chocolate. They're wonderful. I've tried a couple of the different flavors of the pure protein bars. So I kind of think that's probably going to be my go-to, for protein. I've tried several different kinds. The Muscle Milk I didn't really care for. The Goline from GNC is okay. The Quest bar was good. The Pro Max was nasty. Another thing I've tried this week that I'm really, really liking is freeze-dried strawberries. These are from Walgreens. This brand is a Walgreens brand, which is I don't know if they've got it across country or not. I know they've got them down in the East Coast, but it's a pharmacy, drugstore kind of chain. Anyways, these are 100 calories for the whole entire bag. I don't sit and eat the whole entire bag at one time, although I will say probably throughout the entire day I do, or close to it. It's 24 carbs. It's no fat. It's 1 gram of protein. It's just a really good little pop. It tastes like, it's not really a cracker, but it does have a little snap to it. Nothing in it except strawberries. It does have 13 grams of sugar. So, also this week I tried Butterball turkey jerky. Given the choice between turkey and beef, I'm probably going to pick beef every time. I'm not a huge turkey jerky fan. I tried the oven roasted. I couldn't even get past the smell of it. I didn't like it. Gave it to my dog, actually. This is teriyaki. It's edible. The smell still kind of nauseates me a little bit. Actually, when I open the bag, I have to hold my breath. That's how much I don't like the smell. But the taste is okay. It is 11 grams of protein per 1 ounce, and there's 3 ounces in the bag. It's only 80 calories, 1 gram of fat, 7 carbs, 6 sugars. It's really good for you, but it just doesn't taste that great. What else? My surgery's in 12 days. I think I said it was at 7:30 in the morning. I have to be at the hospital at 5:30 in the morning. I live in another state, which I live in Indiana. The surgery is in Kentucky. It probably will take me maybe half an hour, 40 minutes, depending on traffic, to get over there, and which presents a whole new problem because my mother is 82. She's in a wheelchair. She really wants to be there when I have surgery, which means, and she's in assisted living, which means we have to go and get her up, like at 4 o'clock in the morning. I really, really hate to do that to her. Of course, she says, doesn't matter, I want to do it. We're trying to figure out a way around that. My sister is not going to get to come in for my surgery after all. But my stepmother is going to, my dad is actually in a rehab nursing home type situation right now. And so she's going to take that opportunity and come up and be with me during my surgery, which will be nice, and she can kind of help ferret Mom back and forth. There's a river, Ohio River, separating my state, separating Indiana from Kentucky, and it's quite, well, we tease about having our passport. I mean, it's just a bridge, but you'd be surprised at how Hoosiers view that bridge, at least the ones that don't have to go across it every day. I can't really think of the word to describe it. It's just kind of like it's a big deal. It's not a big deal, but it kind of is a big deal. So, when we talk about, well, we've got to go over to Louisville, Kentucky, our first thought is crossing the bridge, getting through traffic. I live in a kind of a rural community, so yeah, it is kind of a big deal. So my stepmother will be there. Hopefully she will be there to help get my mom back and forth across and yada yada. So I've done pretty well on my 1500 calorie. I don't have to go back and see. I do go back for another class next week just because I joined a support group through the weight management center that I'm going through. I joined their Thursday night support group. We meet one Thursday night a month. So next week I will be going to that. Other than that, I have no other appointments until 12 days, day of surgery. So I'm anxious and getting ready. I got my spirometer yesterday and just picked up all the information, got all the do's and don'ts, and the nurse, talked with me about what, I can expect as far as drainage tubes and, the wraps they put on your legs to prevent blood clots and all that good stuff. Is there anything else? Shout out to Sheehan VSG. She had her surgery 2 days ago. I haven't seen an update on YouTube yet, but we'll be looking for that. I'm really excited for her and know she's going to do well. So we're pulling for you. Sheehan said a prayer for you the other day. I know everything will be all right. So look forward to seeing your progress. And you guys have a great weekend. Bye-bye.